think one of the major issues that people deal with being homelessness is how they're treated. Mm-hmm. The initial, the people that's supposed to service you, where there's buildings, institutions, programs, mm-hmm. they treat me as if I've never had it before, mm-hmm. as if I've never done it before, as if I can't do it better than them. Mm-hmm. And God knows I can. Even their job. I've worked in a facility before mm-hmm. where people were homeless, where people were drug addicts. So it's not like I don't know how the system works mm-hmm. being on the end of being a staff member. Mm-hmm. So being a person who needs the service now, mm-hmm. because of condition, they assume that I'm lazy, mm-hmm. they assume that I'm not smart, mm-hmm. they assume that I'm not educated, mm-hmm. they assume that I'm not a person who's involved in their community. I'm a person who's heavily involved in my community. Mm-hmm. So it's really crazy that, I'm not as being looked at in terms of what's already provided, in terms mm-hmm. of the popular noise of service. Mm-hmm. the noise that anybody said they was homeless right now, we can all say, this is the place you go to. You know what I'm saying? We can all say, this is the place you go to. Everybody can say, go to Cold Blue. But how much of Cold Blue, or whatever it's called now, because
Weinberg Housing Research Facility.
That.
Mm-hmm. As one of the former residents of it, it is terrible. Because most of the time, you got guys in there that's, okay. You got guys on there who do not appreciate or dishonorably taking showers. It's like some of the health conditions that they were talking about is you got bed bugs and mm-hmm. God knows what's going on in there. Mm-hmm. You got staff members that's telling you to do things that that wouldn't usually go against mm-hmm. a normal person's population. Mm-hmm. It's so many things going on in there. Mm-hmm. It's confusing to a normal person. It gets confusing to a normal person. Like when I went in there, I was like, okay, mm-hmm. I'm just gonna do what I'm gonna do best. Oh yeah, you gonna tell me I can't do this? I'm gonna do this and make sure I get this done. Mm-hmm. It took me to come in here to get my housing and voucher, and, mm-hmm. and I've been in there for 2, going on 3 years. Mm-hmm.
A lot of places, they have plenty of resources for people who are homeless. I talk to them on a daily basis, and I know exactly what's going on with them. Like, Cold Blue, they don't even help nobody. Exactly. It's the conditions inside of Cold Blue are horrid. Exactly. They're not it's health code code violations all the way around. Mm-hmm. So it's you're supposed to be helping someone, but you're just gonna make them sick. Mm-hmm. Mm-hmm. But a lot of places that have so-called resources, they don't even social services, for example. Half the things they have there, grants and all that stuff to help, mm-hmm. they don't tell no one about. Nope. Mm-hmm. You have to literally research it. They should be offering it. It's for the public, mm-hmm. and certain resources can help people from being homeless to not homeless no more.
Hi, so welcome to the Weinberg Housing and Resource Center. We're Baltimore City's largest homeless shelter. Here we have 275 residents and an additional 200 to 300 people who use us as a day resource center every day as our guests. So one of the biggest changes since Catholic Charities took over is providing the long-term bed stay option for our residents. Again, we have 275 residents, which is comprised of 175 men, 75 women, and 25 folks in our convalescent care unit. And all of those residents don't have to be back until 8 p.m. every day. The exception to that rule is if they do have a verified documentation that they were either in the hospital that day or that they were at work that day, at work from their employer, we do extend that curfew to whatever is needed. Welcome to our laundry room. This is the space where our volunteer resident monitors, or VRMs, our residents who volunteer with us, give back in a really positive way. They actually do all of the laundry for the entire building. We have 275 residents who get all of their laundry, both personal laundry as well as linens, done once a week. And there's a rotating schedule so that our volunteer resident monitors are working anywhere from 6 to 10 hours a day, volunteering their time to wash linens and personal laundry. That does also include when someone becomes a resident for the first time, all of their belongings get washed. So that way we're ensuring the highest sense of hygiene possible. So every year we have a goal that we want a certain number of our residents to move into permanent housing. That doesn't include other types of housing, so like transitional housing or recovery programs or things like that that might be less permanent, that are still a positive step from moving out of here. But in the past year alone, our goal was to move 100 residents into permanent housing, and our grand total was 139. So what I think is really beautiful is, since we have this like long-term bed stay program, we do get to know our residents better, and they get to know us better. So we really have the opportunity to walk with them in their journey, to know them, to know where their struggles are and where their successes are, and to celebrate their joys with them. Just today, I have a really dear resident of mine who came to me and told me he has an interview tomorrow morning. And I would be excited for anyone who told me they have a job interview tomorrow morning, but to know this particular resident, to know that he has this specific interview at the company that I'm familiar with, that I knew would be a great fit for him, those kinds of things are pieces that we can work with more closely. So we do have the opportunity to work with residents in their greater struggles, because we know them better.